As one can imagine by looking at a newspaper, watching television, or even seeing a movie, there are many technological advances in medicine that just a few short years ago might have seemed like science fiction. This year they've developed something in Germany called a microendoscopy. It is a micro-sized microscope. It's only 8 millimeters in diameter, which would allow a doctor to insert that into a patient, much like they would a scope. Go into the patient and in real time look at cells throughout the patient's body and be able to identify it without having to take a biopsy or a tissue sample from an organ or some other body part and send it off to a lab and wait for the lab results to come back. Now this would give them almost immediate response and identification of something wrong with a patient, and a much less invasive than a biopsy, and this would give the doctor a lot more rapid and immediate options to properly treat the patient. And another technique that I found intriguing is called a DNA chip. Basically it's a computer chip that has a DNA sample of one or multiple illnesses such as cancer, leukemia, things like that. DNA will bind with like DNA. So what this chip does is you actually put a blood sample from the patient on this chip. If there's any disease that's listed on that chip in the blood sample, it will adhere to the DNA chip. They can then insert that DNA chip into a computer, and the computer has an exact listing of any illnesses that the patient may have that is listed on the chip. Of course, it has to be listed on the chip. This is technology, it's not magic. But imagine this, it's like you go in for a routine checkup, take a blood sample, much like what a diabetic will take a blood sample to measure their blood sugar. Imagine going in for your physical, the doctor takes a blood sample, runs it through this DNA chip, plugs it into the computer, and the computer comes back and lists any ailments or diseases you have before you even know it, before you have shown any symptoms. Now the doctor has these illnesses identified, so they're able to treat the body before it's sick and been weakened by this disease. So imagine the possibilities of curing or stopping a lot of diseases before it ever becomes costly or debilitating or deadly. As an example, for some of the other things that St. Vincent's Medical is using information technology on, is something called Erie Home Services. They have combined with an at-home medical company to facilitate or to work in partnership with this home care to allow people who don't have access to it or aren't able to because of spacing or availability. They're allowed to get home care by an independent company, this Erie Home Services, which will be linked and integrated with the St. Vincent's Medical Center. So you can get clinical care at home without having to go to the hospital, but you can still get all the same diagnostic and medical tool or medical information available to the home care specialist. Cut. I'd like to thank you for these brief few moments. If you'd like more information, please read our report. It is amazing, and scratch that one. Thank you, and good evening. Scratch that one. Thank you for your time. If you'd like more information, please see our report. There's more detailed information. It's amazing to me and touching to see. Scratch that. Thank you everyone for these brief few moments. I have only touched on a portion of what we discovered. If you'd like more information, please look at our report or do more extensive research on your own if there's any part of this that touches you personally. It is interesting to see the advances that medical technology has made. Aside from the TV shows and the movies, it's amazing to see what the possibilities are, what St. Vincent's is doing now, and the possibilities of what they will be able to do for us as patients in the future. Thank you. Have a nice evening.